IODUM in diabetes. The purpose of knowledge shared here is only educational and to increase awareness. Please always consult your family doctor before using any medicine. Self-treatment may always be injurious. डायबिटीज ठीक नहीं होती ऐसा विश्वास किया जाता है, किंतु यह सत्य नहीं है। यदि आपको डायबिटीज है और यहाँ बताए गए लक्षण आपको हैं, तो आपके लिए आयोडियम उपयुक्त दवा है। आइए जानें कि डायबिटीज नामक बीमारी में दवा आयोडियम कब उपयोगी है। पॉलीयूरिया, urine bright yellow, thin watery, constant restlessness, can neither sit nor sleep, canine hunger, yet loses flesh, followed by anorexia, coldness of hands and feet, rough dry skin, often containing nodosities, heaviness of legs, as if they were of lead, dizziness with tendency to fall forward. आइए आयोडियम के अन्य महत्वपूर्ण लक्षण भी जानें। Cases requiring iodium when not febrile are apt to have great appetite but rapid emaciation, great debility. The slightest effort induces perspiration. It is indicated in numerous wasting diseases in scrofulous patients, acute dacryocystitis, Mollitiesossium, lymphatic tumors in various parts. The mental condition of the iodium patient is generally one of despondency. But during fevers and wasting diseases, we often meet with excessive irritability and sensitiveness, much like that found under sulfur, restlessness, which renders sitting quietly or sleep impossible, persistent headaches with vertigo on active exertion, or congestive headaches with vertigo in old people, vertigo worse from stooping, worse in warm room, tubercular meningitis, a valuable remedy in inflammation of the iris, especially if of syphilitic origin, chronic deafness with adhesions in the middle ear or granular enlargement, deafness with chronic goiter of the eustachian tube, inflammation of the tonsils, roaring in ears, a very valuable remedy in acute fluent coryza. The discharge is hot, the nose becomes sore, headache at root of nose and over frontal sinuses. The attack is attended with fever, sneezing. In subacute and chronic goiters, discharge fetid, nose swollen and painful. Acute inflammation of the tonsils with hoarse cough and deafness. The eustachian tube seems to be especially involved. Ulceration of the throat and mouth, syphilitic or mercurial with swollen glands, aggravation from warmth. Very rarely indicated in any stage of diphtheria. A large number of cases of goiter have been cured by the internal administration of the iodium, and many cases of goiter have been dissipated and followed by alarming pulmonary symptoms from the external application to the goiter. Valuable in mumps, enlargement of the spleen with salivation, diseases of the pancreas with salivation, vomiting and profuse watery or frothy stools. The cases reported are both acute and chronic. In the chronic form there is constipation. In some of these cases there is a depressed, irritable mood. Numerous cases of meningitis disease, glandular enlargement, emaciation, irregular stool, enormous appetite, jaundice with cirrhoticliver, clay-colored stools, tenderness over the region of the liver, especially after the abuse of mercury, chronic exhausting diarrhea, stools frothy, whitish, fatty diarrhea from disease of the pancreas, diabetes with canine hunger, incontinence of urine in old people with senile degeneration of the prostate, enlargement of testicles with pain extending to abdomen. Many cases of hydrocele have been cured by the internal administration of the drug. Amenorrhea, uterine hemorrhage after every stool with atrophy of the mammae, aggravation from warmth, dwindling of mammary glands, chronic excoriating leukorrhea with atrophy of the mammae, goiter, induration of the cervix, chronic inflammation of the ovaries with thick yellow burning leukorrhea, ovarian cysts, chronic metritis with intense pain, nervousness, constant urging to urinate, heat and dryness of the vagina, cancer of the uterus with profuse hemorrhages, corrosive yellow discharge, ravenous appetite. A characteristic is a wedge-like pain from right ovary to uterus. In croup, inflammation of the larynx and trachea with hard croupy cough, difficult breathing and fever indicate the drug. Membranous croup, it is indicated in cases in the early stage with more or less fever, with dry skin and very dry cough, great difficulty in respiration. It follows closely after aconite. If aconite has been given and the patient is not improving, or if aconite has relieved only restlessness and extreme anxiety, but not the cough, the patient is still dry and hot, and the cough is still croupy, then IODIUM comes. It is, however, rarely useful after febrile excitement has disappeared or if the patient perspires freely. This stage, together with the attacks of suffocative cough, indicate bromium instead of IODIUM. In catarrhal laryngitis, the larynx is sore to touch, the cough is dry and croupy, and there is an excoriating watery discharge from the nose. Compare with ileum cepa, whooping cough with emaciation and with enormous appetite, chronic laryngeal catarrh with dry croupy cough, sighing respiration, soreness of the upper part of the chest. It is one of our most valuable remedies for pneumonia. In these cases, it must be carefully differentiated on the one side from aconite and on the other from bryonia. It lacks the anxiety of aconite and the sticking pains of bryonia, but it has the high fever of each. Like bryonia, it is indicated when hepatization has taken place, contraindicating aconite, and the cough is dry. It was formerly supposed that left-sided pneumonia indicated IODIUM, but it is now known that it is equally useful in pneumonia of either side. It is particularly useful in the pneumonia of scrofulous subjects, especially in pneumonia at the apex. Thysis pulmonaris with rough voice, dry cough and night sweats. Sweat very profuse at night, very exhausting in the morning hours, of a sour odor and with much thirst. Hyperpyrexia or external coldness with anxiety or stupor. Valvular insufficiency with periodical attacks of pain about the heart following typhoid, dilatation of the right side, pericarditis complicating pneumonia, hypertrophy of the heart, articular rheumatism, sometimes with heart shiny swelling of the joints with great swelling pain, articular rheumatism complicated with pericarditis. In these cases there is generally nocturnal aggravation, wandering rheumatism which even seems to attack the meninges of the brain and finally attacks the heart. Subacute inflammation of the knees with fistulous openings discharging bloody serum, nightly boring pains. Housemaid's knee. Scrofulous affections of the joints. Affections of the joints are of the articular extremities of the bones, following mercury or syphilis, nightly pains and curvature of bones, गोनोरियल rheumatism. वीडियो में बताई गई जानकारी यदि उपयोगी लगी हो तो चैनल को सब्सक्राइब करें, वीडियो को लाइक और मित्रों में शेयर करें जिससे और लोग भी लाभ उठावें। घंटी का बटन दबाएं ताकि अगले वीडियो की सूचना आपको मिल जाए। कमेंट में लिखकर बताएं कि आप होम्योपैथी में क्या जानना चाहते हैं, मैं उस विषय पर वीडियो बनाने का प्रयास करूंगा। चैनल को अधिकतम लोगों के लिए उपयोगी बनाने हेतु तो अपने सुझाव लिखें। वीडियो को धैर्यपूर्वक अंत तक देखने के लिए आभार और धन्यवाद। होम्योपैथी सेफर एंड सुपीरियर मेडिसिन, यूज होम्योपैथी, स्टे हेल्दी एंड इम्प्रूव योर इम्यूनिटी। होम्योपैथी अपनाएं, स्वस्थ रहें, अपनी रोग निरोधक शक्ति बढ़ाएं। हेल्दी पीपल प्रॉस्पेरस नेशन, स्वस्थ जन समृद्ध राष्ट्र। A good guideline to remember is homeopathy as the general rule, allopathy as a last resort. If the proof of the pudding is in eating, it is impossible to deny that like cures like. To suffering humanity, from homeopathy to achieve health and longevity.